Okay, so this is kind of the takeaway from chapter 6, the acellular pathogens, and I'll mostly talk about viral infections, but this applies to virusoids and prions as well. We want to talk about drug therapies, immune responses, vaccines, and immunization. Um, and this is really a key takeaway. It's one of the most important basic understandings that healthcare providers have to have about infectious disease, and that we should work about really hard with the public to make sure the public understands. So, first of all, viruses are non-living, acellular. They have a genome, they have a protein coat, but they use host cells to do everything. The host cells copy their chemicals. The life cycle varies, but always it happens within the host cells. And there are many viruses. They are very small, it's much smaller than bacteria, hard to identify, you can't see them with a light microscope. They reproduce fast because they're so small. They are faster than bacteria at reproducing. We have great tools for dealing with bacterial infections. These tools are antibiotics. Penicillin was the first one, but we have dozens of antibiotics for dealing with bacterial infections. And the reason we have these antibiotics is prokaryotic cells do many things differently than eukaryotic cells. Prokaryotic cells are alive. They have a cell wall, a cell membrane. They have DNA, they have ribosomes, they have thousands of enzymes. And many of these things are different. Okay? And this allows us to design drugs or to find drugs that attack these unique things that prokaryotic cells do, and it doesn't harm eukaryotic cells. There's lots of targets for killing prokaryotic cells. Okay, so we have even for antibiotic resistant infections, usually we can find another antibiotic that works. Okay, it's really important to understand viral infections can't be cured with antibiotics. Viruses don't have cells. They have no metabolism, only a few enzymes. They don't move. They don't have organelles. They don't make a cell wall. And everything they do, they use host cells for. Okay, host cells, host enzymes. There are very few drugs for attacking viruses. Antiviral drugs don't cure infections of viruses. They generally slow reproduction. Okay, there are several types. For some viruses, we do have some treatments, okay, but they're very specific. The treatments that work against HIV don't work against herpes viruses. They don't work against papillomaviruses because those viruses are different. We have some drugs that um, boost the host immune system, the interferons. Um, we have some drugs that um, target in a kind of way viral genome reproduction, but they're less effective than antibiotics, and they don't cure infections. Okay, probably the biggest class of drugs are the antiretroviral therapy drugs used for the treatment of HIV. These drugs target the enzymes of HIV. Okay, however, it's going to slow HIV production, replication, but not stop it. This is a treatment, an effective treatment that took decades to develop, but it's not a cure. It's not an antibiotic. It's nowhere near as effective, and it doesn't work against any other virus. That's the bad news. Viruses are too different. Okay, they have sometimes completely different genomes, completely different enzymes. The only tool that we have against viruses that can effectively control a viral infection is a vaccine. A vaccine is a preparation of molecules, of antigens that can induce our immune systems to make a response. These vaccines are usually killed or inactivative components of the virus, and they're usually given by injection or nasal spray. What it does is it boosts your immune response. Okay, and these are specific. We have to develop them for each different viral infection. But the good news is vaccines provide long-lasting protection, and they target specific illnesses. They target usually illnesses that we can't treat. Okay, we can give vaccines ahead of time. We can prevent infections, and if we vaccinate enough people, the infection will stop circulating. Vaccines are the only tool that we have against most infections of viruses. Viruses are not cells, so we have very few tools, no cures for most viruses, not even an effective treatment. We're treating symptoms and trying to prevent the virus from overwhelming the person before the person's immune system can respond. Okay, we have lots of illnesses that we can prevent with vaccines, but we can't treat. Okay, this includes hepatitis viruses, it includes cervical cancer, it includes influenza, the encephalitis viruses, polio, it includes measles. Okay, we just recorded a death of measles. Measles is 100% preventable, but it's not curable once you have it. Once you have it, there's no drug that we can give you that will help you. Okay, you're going to have to fight it off with your own immune system. This is really important to understand. Okay, we can use vaccines to prevent viral infections for which we have no effective treatment, no cure. There is no drug cure for any acellular pathogen. It's unfortunate, but it's true, and it's likely to remain true.